If the following story raises any issues for you, you can contact 1800-RESPECT on 1800 737 732 or Lifeline on 13 11 14.
So recently, Australia shone a light on sexual assault as part of Sexual Assault Awareness Month held in April. But for many in our community, there are concerns about safety and inclusive practice when it comes to seeking support. Here in WA, the Sexual Assault Resource Centre provide crisis support services to those in need, working to ensure LGBTQIA+ people feel safe and meaningfully supported. SARC's Dr. Matilda Oke joined Lee for a chat about how sexual assault can affect our community and how SARC can help.
So let's start with the basics. Obviously, everyone has different understandings of the subject, but what is sexual assault?
So sexual assault is any unwanted sexual act or behaviour which is threatening or violent or forced or coercive. And it's activity that a person hasn't given consent for or was not able to give consent for. So sometimes you wouldn't be able to give consent, for example, if you were asleep or if you were heavily intoxicated.
Mm-hmm. But it's not just the incident that really has a lasting effect on people. It's not just the moment. It's what happens afterwards. Can you tell us about some of the effects sexual assault could have on individuals and their families and relationships?
Yeah, absolutely. So it's not just, like you're right, that acute incident. It can have a lasting impact on a person's life and the life of the people that they are very close to. It can affect their relationships. Things that we often see is that can have a significant impact on a person's self-worth. Sometimes people describe things like nightmares, flashbacks and anxiety. So if you are experiencing these things following a sexual assault, it's really important to speak to a psychologist or a counsellor or see your GP or contact a service like SARC so that we can provide you with further assistance.
Now, Matilda, obviously sexual assault could affect absolutely anybody, no matter gender or race or sex or any of those factors. But what is it that makes LGBTQI+ people more vulnerable to these incidents?
Yeah, it's really devastating that there is this difference, and I think there's a lot of things that impact it. Certainly, we see higher rates of sexual violence within the queer community and particularly in our trans and gender diverse community as well. There was a recent Australian study where it was found that trans and gender diverse people are nearly 4 times more likely to have experienced sexual violence compared to the general Australian population. And some of the factors that impact that are, I think, barriers to healthcare, which can include lack of providers that have an understanding about what the LGBTQIA+ community needs, particularly the trans and gender diverse community, and also a fear of discrimination, experiencing stigma, marginalisation, which sometimes people may have experienced with health practitioners.
Yeah, absolutely.
Yeah. So, and I think then following from that, after a sexual assault, I think there's also sometimes fear of approaching the police because of fears of stigma and discrimination, which can affect people in this community reporting sexual assaults as well. Yeah,
so, I mean, you touched on quite a few different barriers there. So could I ask, what is the Sexual Assault Resource Centre doing to make sure LGBTQI+ people are included?
That's a great question. So I'll just give you a bit of a background about what the Sexual Assault Resource Centre offers to everybody. Yeah. And then I'll go into specifically what we're offering, what we can offer the LGBTQIA+ community to hopefully make their experience a bit more comfortable. Mm-hmm. So SARC is a 24-hour emergency service based in metropolitan Perth. We do give advice to rural and remote areas in WA as well. And we offer a couple of different services. Firstly, for anybody 13 and over who have been sexually assaulted within the last 14 days, we can offer emergency counselling, medical care and forensic examinations. And then for anybody who has ever been sexually assaulted or sexually abused, there's also longer-term counselling that our service can offer as well.
Yeah.
when someone who identifies as LGBTQIA+ comes to SARC, we use their preferred names, we use their gender, we use their preferred pronouns, and we also ask what their preferred names for certain body parts are, so that we're using language that the person is comfortable with.
Yeah.
We also will explain, when we do have to use their name that's on their Medicare card, because unfortunately there are some circumstances where we will have to use that name.
Yeah.
We also make sure that we're only asking questions that are relevant. And if the person isn't sure why we're asking those questions, we're always happy to give explanations about why that question might be relevant. So, for example, if we're asking about medications a person might be on, that might be relevant because certain medications can have an impact on, say, genital tissues, and that could really impact the kind of injury profile that we see, which could be useful forensically.
Yeah.
So we only ask questions that are relevant, and we're very happy to justify why they're relevant if a person's not sure.
Yeah.
We're also, sorry.
No, go ahead.
We have a separate set of notes as well that we use with our trans and gender diverse clients. They have some gender neutral body maps in there, and also some body maps with a variety of different body parts, so we can find the maps that work best for people. And what I mean by body maps is sort of outlines of certain parts of the body so that we can document where injuries might be.
Okay.
There's also extra space in those notes to draw genitals or other body parts that might differ from those in our body diagram. So we do try and tailor our documentation to what the person needs.
Yeah.
And we're also trying to educate our doctors, our counsellors about how to best work with the community, and that includes how to best document injuries, how to examine people in a sensitive manner and a manner that is not painful and not embarrassing for the person, and also again exploring the impact that certain medications, certain hormones, certain surgeries might have on the type of injuries that we're seeing, which could be really useful forensically if the person decides to go to the police. And just to confirm, we're not part of the police, but we will certainly support people through the police process if they need that.
Sure. That's great. And a person who's accessing your service might not be concerned about themselves. They might be worried about a friend or a family member or somebody at their workplace. How can they support somebody who's going through this crisis?
Yeah, absolutely. So if you know somebody that's been sexually assaulted and you're concerned about them, the first thing to do is just respond well when someone shares that experience with you. That can make a huge difference to their recovery. So doing simple things like believing them, listening to them, having a non-judgmental approach, not blaming them. And then if they're feeling ready to access services, such as SARC, maybe you can provide them with that information. And also remember that there is a lot of vicarious trauma associated with sexual assault, so remember to look after yourself as well as the person that you're looking after.
And we've seen in the LGBTQA+ community in recent years a growth in the conversation about domestic violence and sexual assault, focusing on how it affects our community. But traditionally, this kind of campaigning targets women. So when it comes to men, gay men, trans men, male-presenting people, where can they get help that's catered to them?
Yeah, it's a great question. So, and we do know that very few, cis men, trans men, members of the LGBTQIA+ community do come forward after a sexual assault. Because of a lot of barriers we've also discussed, but also sometimes there's an intense feeling of shame as well.
Yeah.
So I would encourage anybody who has been sexually assaulted and would like further assistance to contact SARC. We will help anybody, no matter what gender, we will assist them.
Great. So where can people get information and support from your service?
Yeah, absolutely. So we have a 24-hour emergency line for recent sexual assault. I can give you the telephone numbers for that. I'll read them out, but also if you just Google SARC, they'll be there.
Yep.
So one of them is 64581822. 28, or we have a 1-800 number, which is 1800 199 888. And we have emergency telephone counselling between 8:30am and 11pm every day. If you need to access emergency healthcare outside of those hours, or your appointment with SARC is delayed for whatever reason, then